Ok, empezó a grabar.
Perfecto. Bueno, ¿cómo describirme?
Well, how can I describe myself? I am a happy-go-lucky person, always smiling.
El diagnóstico, bueno, el diagnóstico de un cáncer.
The diagnosis of cancer, my world fell, my life fell apart.
Bueno, el primer síntoma se llama...
The first symptom was blood in my urine. In my case, it was different because it was only at the end of urination. It wasn't that easy to see with my naked eye. That's what made me first go to the doctor.
Los pasos, bueno, primero era la
At the appointment with the urologist, I didn't fit the age for having bladder cancer because it usually affects older men or people with cancer history in their family. That wasn't the case for me, so my doctor said the blood in urine could have been caused by a strain. So he told me to come back another time, but then the blood in urine came back. So I got an ultrasound. They suggested it because you can see whether there's a tumor in the bladder. Still, nothing came out, but the blood in urine continued. So they did a cystoscopy where they put a camera into my bladder to confirm for sure. That's how they ended up diagnosing me with bladder cancer.
Primero, en la UCI 3
The relationship with the doctor wasn't great. I was in the ICU for 3 days because of a procedure called transurethral resection of bladder tumor, TURBT. It didn't go well, which is why it took 3 days. Then the doctor took a sheet of paper out and said they were going to remove my bladder. He told me to sign here on the paper and they'd do the surgery in 10 days. I didn't know you could get bladder cancer, and this doctor is telling, I'm going to take out your bladder lightly. Luckily, I had David by my side. He was always by my side. We started looking for second opinions. We even went to 5 specialists and got 5 opinions. 4 of the 5 decided on the same thing. They agreed that for treatment, they recommended preserving the bladder because of my young age, that you don't remove the bladder from a young patient. They actually didn't even use the word cancer. They kept saying polyps. The doctor I'm seeing now who's treating me, it even took him a long time to say the word cancer.
El tema de la segunda...
The issue of second opinions is very important. The patient may forget to get one because he goes into shock after hearing the diagnosis, or because we have the mindset that the doctors are always right, and what the doctor says is what we should do. But this is life-changing surgery. Like when they take out an organ, it'll change your life because it'll put a colostomy bag in. It requires seeing more than one doctor and getting more than one opinion so you can make an informed decision if they are on the same path or not, if they have the same ideas.
Pues ahora estoy en...
I get follow-up appointments every 6 months. I get a urinalysis and cystoscopies. The first resection surgery during the ICU stay in the beginning removed most of the bladder cancer. Since my biopsy results have been good, I have the checkups every 6 months.
Me diagnosticaron en octubre
I was diagnosed end of October 2022, and we tried looking for information on the internet. You will find everything, and you find the worst case scenarios. David was my filter because he kept me from searching online. On Facebook, I found a group of bladder cancer patients, but they were from France. Luckily, my first language is French. They supported me in the group. I joined at the same time as 4 other patients. 3 had their bladders removed, 1 passed away. It's a support group. They live what I live in bladder cancer. We discuss treatments. We have anxiety at every appointment. We know the shared pain. We were introduced to the World Bladder Cancer Association in Madrid, and that's how we started CANVES.
No creo que es común. No creo que es común esta forma de decir al paciente.
I don't think what happened to me happens to all patients. Telling the patient to remove his bladder and sign the paper here. I think it has to be nuanced. And it depends on the experience and empathy of the doctor who's taking care of you. In Spain, there are 2 healthcare systems. You have the public healthcare system and private healthcare system. If you have the private healthcare, it works great. So does the public system, but it takes more time. You can't get an appointment as quickly or often. Doctors usually don't have more than 5 or 10 minutes to talk to each patient. That's actually a Europe-wide problem with the healthcare system. I'm from Belgium, and the same thing happens there. That's why we created CANVES. We understand doctors don't have time or a lot of time to dedicate to their patients, to give explanations or support. So we want to give the patients the information. That's the motivation, to make sure no one has to be alone with this.
Hay más de 22.000 casos anualmente en España.
There are 22,000 cases of bladder cancer each year in Spain, which makes it one of the most frequently diagnosed cancers here. There was no patient association here. Nothing. Resources, nothing. Support, nothing. It's true that most patients who have bladder cancer are men, and those who are older, and most patients are men. Men don't talk, they don't go to the doctor. It seems different for women since they are little. We tell them to go to gynecologist as soon as puberty starts to get tested. We don't have the conversation with boys to see urologist until normally 40 or 50 years old to get tested. In Spain, bladder cancer has never been heard of.
Hemos organizado
A milestone. This year we organized the first National Bladder Cancer Patients Day. This was so important because we had the support of the Spanish scientific societies. This was huge because it happened in a short time and unites all these professionals to help people in one room. That's the most important thing for us, helping people. We get emails, we talk and speak to them every day. This is the best thing we can do and why we exist. We hope to have better information and build a faster line of detection. So if a patient goes to the emergency room with blood in the urine, to implement a protocol of tests to see whether it's bladder cancer, because most of the time, with early detection, bladder cancer is curable.
Que no hay que tener miedo. Eso.
There is no need to be afraid. When you get this news, you just have to keep going and keep living. That's the most important thing. For many people, you think, why me? The cancer diagnoses are more and more common. You have to keep on living because life is short.
Porque la vida es corta, hay que decirlo.